to be speaking to you about disorders of menstruation. A lady's menstrual cycle can vary in duration. The average length is anywhere between 21 to 35 days. The start of the menstrual cycle is from the first day of your actual bleeding to the first day of the next bleeding. The duration of the bleeding should last anywhere between 2 to 8 days, average is 4 to 6. And so the menstrual cycle can be disrupted by a number of things. It can be because of abnormalities within the uterus itself, such as fibroids or endometrial polyps, or abnormalities other places in the body, such as the thyroid gland, the pituitary gland. They all have a very important role in the regulation of hormonal changes which affect your menstrual cycle. One of the common abnormalities that we see are irregular bleeding, where women have a menstrual cycle monthly, but they also have bleeding at other points during the month. We call this abnormal uterine bleeding, previously referred to as menorrhagia, when you have more than 8 days of bleeding in a month. So anytime that is the case, depending on the age of the woman, we have different ways to investigate that. One of the most common causes of heavy vaginal bleeding are uterine fibroids. Those are benign muscle balls that are found within the muscle wall. They can make the uterus much larger than your average non-pregnant uterus. An average uterus is somewhere between 6-7 centimeters. A uterine fibroid can make your uterus as big as 20 centimeters or more. And so because of this increased size, you have increased blood flow to the uterus. The endometrium, which is the part within the uterus that builds up and sheds every month, is bigger and more unstable, so you can just bleed throughout the month. So we diagnose that usually through ultrasound. Polyps are little mushroom-like growths that occur within the endometrial cavity, and they're unstable. They're not like your regular tissue that grows and then breaks down at a certain point in a month. They just grow and can bleed randomly. So the woman can have bleeding after intercourse. She can have bleeding in between her menstrual periods, and typically the way we remedy those are to remove them through a D&C. Same thing with uterine fibroids. We can remove those through, the ultimate cure would be a hysterectomy, but you can remove individual fibroids if the woman wants to retain her fertility, or we can try contraceptives. There are hormonal causes of abnormal bleeding. So sometimes women don't have a lot of bleeding. They may have an absence of their menstrual period for months at a time. One of the most common causes of that is polycystic ovarian syndrome, also known as PCOS. These women do not ovulate monthly. They have very infrequent ovulation, and it's because their estrogen and progesterone balance isn't in sync as it should be. These women have estrogen most of the time because very seldom do they ovulate. After ovulation comes progesterone. Estrogen is important to build up the lining, but progesterone stabilizes it. And then once that progesterone goes away, that's when we have our monthly menstrual cycle. So when they have that lack of progesterone and withdrawal, they have estrogen, they build up. And then there comes a point in time where that lining gets so unstable from being so thickened that it just starts to bleed. So the bleeding is very uncontrollable and unpredictable. But also estrogen can be dangerous when it's unopposed like that for a long period of time, because it can lead to hyperplasia, which can lead to endometrial cancer. So any woman who previously had a regular cycle but then starts to not have one for months at a time definitely needs to go be examined by her doctor to make sure that we can figure out what's going on. Of course, your first thought is pregnancy. You rule that out, but after that's ruled out, we look into PCOS. We also look at thyroid dysfunction. Having a low-acting thyroid can affect your menstrual cycle. Usually hypothyroidism tends to make your cycle less frequent, and we check that by looking at your TSH. And then having disorders of the pituitary gland, such as Sheehan syndrome, which can happen after, say, a vaginal delivery. If a woman loses a lot of blood and the blood supply to her brain is temporarily compromised, the pituitary can be damaged. It produces important hormones that regulate the ovarian function, which in turn affect the uterine cycle. Those are all important things to look into if your cycle suddenly goes away.